think we used it as first aid and haven't stopped using it since.
We used to send quite a few referrals to the ambulance, to 999, when we were attending falls, and we're now able to resolve and raise that person and really see the impact of being able to do that firsthand. We're a domiciliary care provider and telecare provider within Southend.
So previously, before we had the Raizer chair, obviously people fall at home. They can be left for a number of hours on the floor. We would have to, if we found somebody on the floor, whether injured or not, we weren't allowed to help them up. And if they'd been on the floor for a number of hours, they usually had a poor outcome and would have to be conveyed to hospital. So it took capacity out of our workforce because of the number of hours we had to remain with somebody in their own home.
Let's say that there is a long lie. Let's say that person goes into hospital due to increased injury, due to the long lie, and then that moves on to increased care need, post-hospitalisation, the time that they've been in the hospital, again increasing costs and increasing pressures, and then coming out of hospital again, the care needs to be reassessed, adult social care team need to be involved, social workers need to be involved, Ashley Care needs to be involved, family members need to be involved. So there is really numerous stakeholders throughout that process that are inflicted by a fall that could otherwise be prevented if we were able to pick that person up off the floor, and we're able to do that now. We had the training was fantastic, it gave the team the confidence, we were able to cascade that down to senior members of our team. We had the process and now policy that we've put and developed.
If one of our clients falls, they might have a care line button, so they'll press that, which will alert care line, who then contact us. Or some people don't have care lines, so the staff member going in on a visit might find them on the floor.
So if we get a call, we've got a service called Telecare Response, where we get called out where people have pressed their pendants. We will go and assess them. We use the HelpFall app, which will direct us to whether this person can be lifted off the floor safely. If they're okay to be lifted once using the HelpFall app, we will let them know what we're going to do, introduce them to our Raizer chair and our equipment and let them know they're safe. There'll be 2 colleagues, we put that together and we lift them safely.
It's an innovation that makes a lot of sense, and I think that especially in instances of non-injurious falls, there's often the question, why can't we do more? Why can't we pick up? We feel in these situations that we're with the person for 10 hours, possibly, if that's how long the wait time is, and we're helpless in the sense that we can't pick the person up, but we know with a good bit of kit and the right digital tool, we could be. So I think that enthusiasm has spread. I think the team have now embedded this, as I say, and it's part of our practice, and it's really had a huge impact. When we've been implementing the Raizer chair, we found that within the first few weeks we had significantly positive results. The individuals that we actually do pick up off the floor, they're obviously happy in the sense that they now don't have an ambulance call out, they don't need to go into hospital, and some of the quotes of people, dare I say, actually enjoying the experience of being raised off the floor, being relieved of that anxiety.
So having the Raizer chair has made my job a lot easier. Sometimes I'm called out during the night for a Telecare, which is a different service, and if I have to wait for an ambulance in the past, you know, I could be there from 10 o'clock at night until 6 o'clock in the morning waiting for an ambulance for an uninjured client, whereas if they're not injured, I can just get them up easily with the Raizer chair and HelpFall app and pop them back into bed. So yeah, it's made my job a lot easier.
And even with minor injuries, a skin tear, or if we just think this person's been unwell and that's the result of them being on the floor, we can involve other services rather than paramedics. So we work in collaboration with the local authority so that they still get medical attention, but they're back into their armchair, they're comfortable, they're having their cup of tea and they're just waiting to be checked over. It cuts out all of the waiting around, it cuts out putting pressure on the ambulance service. So I think in total, really, it's not only cost effective for other services as well, it reduces the time spent with somebody, so you can go on to your next job.
Where we can avoid admissions, where we can avoid ambulance call-outs, and we have proven to done that with Felgain's technology, with the Raizer chair and the HelpFall app. We can relieve some of that pressure, and I think our team like to feel empowered that they are able to respond, they're equipped with the technology to be able to do that. We found a 76% reduction in ambulance call-outs. We're on average picking up 2 people at least per week. So we're finding we're having a really big impact on both our service, the logistics, the operations of our service, relief from the ambulance service, and also the wider impact on that person. Into the system, you have a reduced amount of care need, you have a reduced amount of hospitalisations, and again we've within 8 weeks had a 76% reduction in hospitalisation. We had a 91% reduction in ambulance call-outs for our Telecare service. So in terms of the amount of falls we were attending, we were preventing that person having an ambulance call-out in a large majority. And I think that says in itself the benefit it can have to the system. By using a digital tool, we're able to upskill the care workforce, we're able to add value to the health service through the upskilling, through the digital tool. And this is something that there's very little barriers to implement, adopt. You have the HelpFall Assessment app report, so you have all the documentation you need, and with the right training, with the right process and policy to ensure that you're safeguarding the individuals, both picking up and both being picked up. The impact that this could have more broadly and both in different jurisdictions and different ICSs could be really significant. And I think you could see domiciliary care providers being able to have a lasting significant impact on the amount of ambulance call-outs, especially within falls. So I think in delivering good care, in delivering safe care, responsive care, it's been a clear benefit to us at Ashley Care.